Jen, I talk often about healthy people have regular sex. So what is, regular could be once a year. I don't think that's healthy. Regular could be once a month. I don't think that's healthy. So what's the average and what is healthy?
It's, it's such, from a medical perspective, it's like, I'm going to give you kind of my opinion based upon surveys and what I've seen. And then also like to talk a little bit about the medical perspective, which is a very, very messed up way of answering this question, which is, if we're talking about low libido, low sex drive, the medical diagnosis for this is called hypoactive sexual desire disorder, which I know you know. And we get that diagnosis, like as physicians, as doctors, we give that diagnosis when somebody reports to their doctor that they've had a low sex drive for 6 months. So if somebody comes to me and like, hey, doc, I've had a low sex drive for 6 months, then I could diagnose them as hypoactive sexual desire disorder. But it's really this like psychological circular thinking, right? It's this circular logic to say, I'm going to define it by itself, to say, oh, in order to get a diagnosis of essentially low desire, I have to tell my doctor I've had low desire for 6 months. So it's like, well, that's such a stupid medical diagnosis,
right?
Because it's like low compared to what? It drives me nuts, right? And it's why this question's so important. So when I've seen surveys around, okay, when do couples report having the happiest relationships? How much sex are they having? And it is on average about once a week. And so when there's been other surveys that have looked at, okay, well, is there a significant correlation with couples that have 2 to 3, sex 2 to 3 times per week and relationship happiness increasing? There hasn't been anything that I have found that's statistically significant around going from once a week to 2 to 3 times per week. That being said, we always want to remember beyond a relationship, all the other things that the chemical oxytocin can do for us, the orgasm chemical, when we are actually intimate, and anything from helping with anxiety and depression have been studied to even there's a study showing that oxytocin can help reduce osteoporosis in women, which is, pretty profound, especially that being a huge thing in the menopausal age. We see improvements in sleep. We see improvements in happiness. So I generally look at this around like, okay, with surveys like that, my goal for people is to be having sex at least once a week, as kind of like the baseline. And then if you can get with your schedule and all that, you can get, 2 or 3 times a week. I think the extra health benefits are there, but that's my general recommendation is really at a minimum going for that once a week, because from a standpoint of relationship preservation and happiness of the couple that way, that does seem to be kind of like that sweet spot of like, we can all probably, we all should be able to prioritize committing to the person in our life who we say we are like probably valuing more than anything else, that we want to at least give them once a week to deeply commit, and then more if you can.